Hi, and welcome to the Equality, Diversity, Inclusion, Health Psychology podcast. In this conversation, we're going to be talking about the route for trainees and students in the profession. This is a series of podcasts in the Equality, Diversity, Inclusion space. My name is Dr. Jolel, and I'm a health psychologist. And one of the things that I wanted to talk about is how can we make this much more inclusive for our people and our students, the people who are going to be doing the work, what barriers are they facing, but also what solutions are there. So we are joined by a guest named Suhana, Dr. Suhana Begum. She's also a health psychologist, and she'll be sharing her experiences and her insights into this area of EDI in health psychology. Welcome, Suhana, to the podcast. If you would like to tell us a bit about yourself, so an introduction, that would be great for our audience.
Hi, Jolel. Thank you very much for having me on today. It's really nice to be on to have this chat with you. So thank you for the introduction. So yes, I am a health psychologist by background, and I work in public health. So I'm a senior public health specialist in a local authority public health team. And I've been so most of my health psychology work has been within public health, and I've been in public health for about I think just over 10 years now, actually, so quite a while.
How did you get into health psychology? By the way, welcome to the show. I should point out if anyone's listening. Welcome to the show, and thanks so much. But how did you come into then the health psychology role? Was it when you were in public health you came across it, or was it actually health psychology first and then you got into public health? Which way was it around?
It was sort of kind of at the same time, really. So as part of my health psychology, so I did my undergraduate psychology degree, and then took a little bit of time out, did some work experience, and actually in my final year of my psychology degree, I did a module in health psychology, and that really piqued my interest in the subject. So then after I finished my undergraduate degree, I did a little bit of work experience. So I did some sort of volunteering in working with a cardiac rehab team to kind of try and understand some of the kind of principles around kind of behavior change and kind of behavior, and just but in a practical applied setting. That was before I did my master's in health psychology. And as part of my master's, I think a lot of the topics that are covered in health psychology are quite relevant to public health. So, we're talking about sort of population level health issues, so things like smoking, things like healthy weight, and obviously behavior change in general. How can we encourage behavior change, from an environmental perspective? What can we do to kind of facilitate that behavior change on a wider perspective? So doing the masters kind of really got doing the masters kind of showed me, I think, where I felt health psychology could really be applied, and that was in public health. So yes, then I got into so I initially started working as a health trainer, and then I got into kind of a bit more of the sort of public health promotion work. Then I've done sort of some work in public health intelligence, and now I'm in sort of the more kind of strategy and policy side of things.
Yeah, that sounds really interesting in terms of okay, that's where you started off, health trainer. I remember working in public health in those sort of roles. And when was it for you then that you decided to become a health psychologist or take that stage 2 training? Like, you done your masters, went into public health, and what prompted you, I suppose, to go into pursue stage 2, if you like, to become a health psychologist?
I think there were a few factors. So I think one was, I think obviously the role that I was in, was really kind of applying health psychology principles in a public health setting, but it kind of wasn't really called that, if that makes sense. It was a sort of public health promotion role. But I think actually looking at kind of, the stage 2 route and the portfolio and the kind of skills you have to, the competencies that you have to demonstrate, it was very much aligned with that. So I think I felt that it was something that actually I, was really interested in doing. from before. And for me, one of the things was actually the opportunity. Funding was a big issue, and being able to actually, obviously, if you do stage two, very often you are if you do the stage two taught route, then very often it has to be self-funded or perhaps funded by an employer. And initially, I didn't have it wasn't something that was available to me because I wasn't able to fund it myself. And I think, speaking to my manager in my health promotion role, I was very, very fortunate in that they were able to kind of part fund it for me. If I was able to kind of fund the rest of it. So I think that really, really, that supported my journey overall and kind of in becoming a health psychologist. I think the other route was, the other route that people do is a PhD, which often comes with a stipend, and you can do it as part of your PhD, the stage two route. But I think being able to I think a PhD didn't quite feel right, or it didn't feel like it sort of aligned with my career interests, in the sense that I was really interested, and I am still really interested in the sort of practical applied side of it, rather than the kind of academic kind of research element of it. So I think the stage two qualification felt like it kind of really, I guess it was the best of both worlds for me. It was the ability to be able to kind of further develop my health psychology knowledge and skills, as well as doing it in a practical applied setting.
And did you do the independent route, or did you do the done it through university taught route?
I did the university taught route, yeah. So I did it at City University in London, which is, I think, unfortunately, the course has since folded, but that's where I think it's folded as of last year, actually. But that's where I did mine.
Yeah, and the reason why I asked, because I've shared it before. Like I did the independent route alongside the PhD, and there were so many different types of challenges, like but the funding and stuff like that to pay for it, and that's quite tough. I was just wondering what the experience was like for you. Like I know you said that you got part funded, but you still had to manage to find your own funds to get paid, so to pay for that sort of training. Why did you do it, just out of curiosity? Why did you decide to invest in that way? Is it because of a career? Do you want to make an impact? What was the main sort of reason?
I think there were a couple of reasons, really. I think one was I sort of felt like I was doing a lot of I felt like in my role I was demonstrating a lot of the skills anyway, and actually doing the stage two was a way of sort of formalizing my skills and kind of developing them further. The other reason, I guess, was, I guess for me, it just sort of felt like it was the end. In a strange way, it sort of felt like it was the end of my journey. I felt like, okay, that was the end of my journey to become a psychologist, and that was kind of my ultimate aspiration. And actually, having done the stage two, and I'm sure sort of lots of PhD students would say the same. Having done the stage two, you actually realize that it's not the end of your journey, but actually it's the beginning of your journey, because you really realize how much there's how much more there is still. It's an evolving journey. You're constantly learning new things. So it was I think there was, yeah, that was kind of my main reasons for doing it. And I just really felt like at the time, certainly when I was doing it, just sort of health psychology didn't really, or from my perspective, from sort of my experience and where I was working, I didn't really feel like health psychology had much of a presence in public health. There was a very I think a lot of the principles in health psychology and public health are, overlapping, and they they share the same kind of. I think they share the same sorts of foundations, but the kind of research element, perhaps, or the evidence-based element of it wasn't always kind of present in public health. And I just really felt, doing the kind of master's degree, doing the kind of stage two, I really felt like the two are, really well connected. That it sort of made sense to me that that is where I would kind of that my career would focus on taking health psychology and kind of injecting that in a bit more in my public health work.
No, that's really useful, and I'm sure our listeners will find that helpful, like, because they're probably on that similar journey themselves. And this the podcast that we wanted to discuss was a bit more about what the experience is like for people from different backgrounds, and so we can learn. And this question I wanted to ask around how can we support then people like yourselves from different backgrounds, if you like background like mine's, that are normally quite excluded in these spaces. If you look at the population characteristics, say ethnicity, for example, how do you think the profession can support people like us accessing the health psychology, sort of profession, not just from a public health perspective, but just as a like accessing the health psychology as a career? Like, what support do you think we need? Or perhaps we don't need any support, we're fine. But what's your perspectives on that?
I think that's a really good question. I think so. I think there's two things. I think one is actually perhaps the opportunities that are available and actually making sure that those opportunities are really as equal and as open as possible. So, I mentioned earlier that in order to kind of get some health psychology experience, I did some volunteering. Now that's not, I think I maybe volunteered for a couple of hours a week, but I realized that that's not an option for everyone. For a lot of people, they weren't, working for free for their time isn't an option for them. And I realized that I was in a very privileged position to be able to do that. So actually, if we are talking about sort of, kind of trainee positions or apprenticeship positions or kind of, assistant psychology positions, all of those kind of positions where people might be kind of might be people's way of gaining that experience, making sure that actually when they are advertised that they are equitable and that they are kind of open to everyone, so making sure that they're funded properly, that they are expecting. I mean, I've seen some assistant psychologist roles that are either voluntary, so there's no payment involved, or they're kind of, and they're quite a large time, there's quite a large time commitment, expecting people to work part-time even for free. Different kind of different things like that, or often they can be short-term contracts, so there might be just a contract for 6 months, which again might not really be viable for some people. So I think just making sure that when we are, and those opportunities are going to be more viable for some people than others. If you are from a family where you've got that financial support from your family, for example, then going through the volunteering route, or going through a kind of 0 hours contract route or something like that might be something that you can do. But for some people, that might not be an option. So just looking at, when we are advertising these posts, what can we do to make these posts as kind of attractive and as open as possible, so that we can attract applications from a really kind of varied pool of people. So I think it's making sure that we're doing things within our power as an organization. What can we do as an organization, for example, to kind of support people into these positions? And I think the other thing is actually really making it, I think one of the reasons why it's so important that people, from, certain backgrounds or different, different ethnicity, different working class backgrounds, different, all walks of life really is, I think it's really important in the jobs that we do that we need to represent the communities that we serve. We are, especially in a job like public health, we are working with these kind of communities, and we are kind of looking at, okay, how can we improve the health of these communities? So we need to make sure that we as a workforce are really representing those communities. So it's really important to have that representation and to have that kind of diversity within our workforce. And yeah, so the way to do that is to make sure that the opportunities are as equal as they can be and are as open as they can be.
Yeah, no, that's lots of things to consider there, isn't there? We've just said all really, really valid. I just wanted to get your thoughts on then, what you just said earlier about, the application of psychology in the public health space. Like if we're not, we produce all of this research, for example, and we don't really go to apply it, or there's a gap. If we ignore our own intelligence, and you talk about representation, I would say that's a bit of social psychology. And the biopsychosocial model is a very, active model, if not active approach, the way we discuss health issues. Then why we're not applying it in that sense? I don't know what your thoughts around that. What you think then, if we know that intelligence, we know that information, we know the data, why are we not doing it? Do you think? Like, what are the barriers? Do you think?
I think so that's quite a broad question, and
Yeah.
there's a lot to kind of think about there. But I think one of the things that certainly from kind of my experience in public health has actually been to actually question the evidence base a little bit. So, we're saying that we've got the evidence base, that this is what we need for certain this is what we need for certain certain sorry, this is what we need. We're saying that, okay, the evidence base is if you want to support somebody to quit, this is the best way to quit smoking, this is the best way to do it. But thinking about, okay, so where does that evidence base come from? So this research that has been done to formulate this evidence base, what's the population that the research was done on? Does the population that the research and the evidence base come from actually reflect our population that we have, And I think that's so it's not, so I think it's just for, again, for us to be a bit more kind of, thinking a bit more critically about what we're looking at and the evidence base and where it's come from, and actually thinking about how best can we even apply these principles. So, smoking cessation, for example, just to give an example. So we've got, in the local authority that I work in, smoking cessation rates have come down and are the lowest that they ever have been, which is brilliant. Having said that, we've got some certain ethnic minority communities where that rate is probably about 4 times the average of the borough. So there's certain pockets within our communities where we know that the smoking rates are very high, for example. So when we are thinking about our smoking cessation model, and then our actual smoking cessation service, which is based on this model, this service that we're delivering, how can we make sure that this service is as kind of appealing and actually is supporting all walks of our community, not just certain groups within our community. So it's really thinking about, I think it's kind of taking a step back and thinking critically about what even is, I guess I would say, what even are our foundations? So, there's certain kind of principles in health psychology, in public health, that are kind of our foundational principles, but which we kind of, just, I think there's such an ingrained part of your training as well, that it's just something that you just you just accept it, but actually and it's something that you're just so used to using in your work that perhaps it doesn't even occur to you to maybe question it and to think about where has this come from. So actually thinking a bit more critically about a lot of the kind of foundational principles and things that we work with, and taking that step back and saying, okay, let's have a look at this from from a different lens, or let's think about this from kind of a different perspective, and just really kind of starting to unpick that a little bit more, I'd say.
Yeah, and what would you say then you need, like, as a person coming into the field, and you're from this, these people are not from your background who take up this profession. What do you think these people need? I think they need a bit of support and encouragement, definitely, like, because it can be quite isolating, isn't it? I don't know how that important that is, but that feeling of connecting and belonging is important, isn't it?
Yeah, definitely. I mean, I think it's important to make people feel that there is a place for them. So I think making people feel that actually, there is a place for them. I think representation is really important, and actually that kind of representation and then kind of that mentorship as well. If you are lucky enough to be able to find somebody who is willing to mentor you in that space, I think that's a really that's a hugely valuable relationship that can kind of really help you to develop your skills, especially when you're sort of kind of earlier on in your career. So I think having those relationships, and actually for people who are perhaps more senior or people who have got more experience, to actually kind of use that, if obviously if time permits and capacity permits and everything, but using that to kind of really support people earlier on in their career to actually develop their career paths.
And do you think then the person with some more support, um, they're able to have a more positive impact on the people that they're helping, like in the end, like the population or the parts of the society, because they're able to make a valuable input into, say, a solution, or they feel as if they kind of like make a difference or make an impact?
Yeah, definitely. I think, we are certainly, where I'm based in London, and in most of the cities, we are, we have such diversity. And I really think that's our strength. Diversity is our strength, and actually being able to kind of um, learn about different cultures, different backgrounds. And I think, again, it comes back to the point that I was saying before about reflecting the communities, that we serve. So actually everyone has something to bring to the table. And so we've got to make sure that we're making people feel that, and making people feel that their opinions and their voices are valid, and that they do have a valid contribution to this, to the overall to the overall picture. And I think it's really just encouraging people to kind of make their contribution, and encouraging people um, to think about things in a slightly different way, and maybe challenge the kind of the sometimes you might just do things the same way because it's just the way that it's always been done. So actually, encouraging people, well, how about we think about doing this in this way, for example, or taking a slightly different approach to it. So kind of empowering people and making people feel confident that actually they can, if they've got ideas about doing things in a different way, that they can raise those ideas, and kind of support them in doing things in a slightly different way that actually may be more beneficial for kind of, some of these communities that we're working with.
Yeah, and I was also like, we're coming to the end of like the podcast. It's good to hear what your experience was, and also some of your suggestions. Now, before we finish, just wanted to give the microphone over to you. If you've got any final comments, thoughts, if people want to work with you, how to reach out, you can feel free to leave your details. I'll put it on the description anyway. But I just wanted to take the time to thank you on behalf of the team in terms of like taking part in this podcast. Um, and I wanted to give the microphone over to you. Have you got any final thoughts about what we need to have, like supports in place or suggestions in place, or any final take-home messages?
Yes, firstly, just to say thank you for having me on. It was a really interesting conversation. I think in terms of final thoughts, I would really say is to sort of, I guess, to those who are, maybe slightly more experienced, if you do have the time and the capacity, I think, there is real value in actually kind of mentoring and being able to support people earlier on in their career, if that's something they're able to do. Certainly something I'm happy to do. So yes, I'm happy to kind of leave my email address. And if anyone's got sort of any questions about health psychology or public health, I'm really happy to kind of answer those. For people sort of more kind of, starting out in their careers and thinking about, okay, is psychology right for me? Is it a place where I will belong? Is it a place where I'll fit in? I think, I would really, really encourage you to just give it a go. I think it can be daunting, and it can be scary, and sometimes, not seeing other people in your, not perhaps seeing, other people like yourself represented in the workforce, can sometimes feel a little bit lonely, and it can feel a little bit isolating. But I think, it's, I think there's always, I think you've just got to really try and, put yourself out there and kind of try and make those kind of connections and make those links and kind of actually perhaps even support other people who are in your position at one point, to kind of get into those careers. So I would say, don't be afraid to ask questions, don't be afraid to kind of reach out to people, and just really kind of make those connections, and kind of, those networks are so important. And I think now we've got more kind of, online tools, we've got social media tools, we've got, things like LinkedIn, where you can actually kind of find out a bit more about people's careers. So yeah, I would say don't be afraid to reach out and actually just speak to people. And I think generally, you'll find that people are willing to kind of support you, and people are willing to, even just have a conversation about kind of their career routes, and how they got into their career routes. So it's always worth just, seeing if you are interested, listening to other people and finding out from other people how they got into their careers, as a starting point, and as a way of, give you some ideas for how you could kind of start your own career as well.
Thank you so much for your time, Suhana. That was really useful. We might speak again in the future, in a future podcast, but for now, we'll see you next time.